Good afternoon, everyone. Happy Thursday. My name is Rosalind Daniels, and I'm the president and founder of Black Health Matters. I started Black Health Matters to provide the African American community with an integrated health information and community engagement platform that empowers their journey to better health. The month of March is nationally recognized as Kidney Disease Awareness Month. Unfortunately, March 2020, we were all confronted with COVID-19, social distancing, and the impact of health disparities in the African American community. Despite this, Black Health Matters was able to launch a new channel devoted to kidney disease. African Americans experience kidney disease in a disproportionate amount, with more prevalence than other cultures. Today, we're going to speak about FSGS. Dr. Campbell, I may cue you in earlier so that we can give it its due. Focal segmental
glomerulosclerosis.
Thank you. Again, known as FSGS, and much easier to say. A condition which affects African Americans in greater percentages than other demographics. Joining me to discuss this important topic is nephrologist Dr. Kirk Campbell of Mount Sinai Hospital here in Manhattan. He is an associate professor and director of nephrology fellowship program and vice chair for diversity and inclusion in the Department of Medicine at the Icahn School of Medicine at Mount Sinai, New York. In addition to treating patients, Dr. Campbell leads an NIH-funded research program focused on understanding the mechanisms underlying kidney disease progression. He is a NephCure Foundation Young Investor Awardee and a recipient of the Carl Gosschalk Research Scholar Grant from the American Society of Nephrology. Dr. Campbell is a member of the Medical Advisory Board of the National Kidney Foundation, serving Greater New York. So I would like to welcome Dr. Campbell with us this afternoon. How are you?
Thanks so much, Rosalind. Very gracious introduction, and glad to be here.
Thank you. So can you share with us how prevalent kidney disease is in the African American community?
Absolutely. So, 1 in 3 Americans would be at higher risk for kidney disease, right? Kidney disease is mainly caused by diabetes and hypertension. And 1 in 10 Americans actually have kidney disease at various stages, right? Even though African Americans make up about 13% of the US population, they account for about 35% of patients who actually require dialysis. So that's a really significant disproportionate number of patients who progress towards end-stage kidney disease being of African descent.
I see. So and of course, we all know people who don't manage their diabetes or hypertension, and this will eventually could possibly lead to kidney disease. Does FSGS or kidney disease affect men more than women?
That's also a very, very good question. So taking kidney disease first in and of itself, women actually have more chronic kidney disease, as we call it, than men. But men actually progress towards end-stage disease requiring dialysis and transplantation at a higher rate. So we see this discrepancy between those who have the disease from a sort of a prevalent perspective and those who actually progress. So it's very important that every individual follow up with their physician to understand the course of their disease. So it's not a definite outcome that everybody with kidney disease will progress towards requiring dialysis, but some individuals are at higher risk. And of course, FSGS is just one form of kidney disease, right? That's one potential underlying diagnosis that's very important to diagnose.
Understood. What? Let's talk about rare kidney disease a little bit more. What are the symptoms of FSGS?
Right. So, the rare kidney disorders like FSGS and sort of the topic of main conversation here today, it's sort of distinct from the diabetes and hypertension etiologies that really make up about 80% of the burden of overall kidney disease leading to dialysis. FSGS it's sort of a rare disorder, right? Affecting, by most estimates, less than 200,000 patients per year, and it's really a scarring of the kidneys, right? And it's a patchy scarring, right? That you can only diagnose with a kidney biopsy. So patients have to be followed by a nephrologist, a kidney specialist. They need to get a biopsy, and it's really a description that the physician would give to the patient where someone sees scarring, right, on analyzing that tissue sample under the microscope. And it's actually caused by a number of different things. Some are genetic. So this is a disorder that tends to run in families. It's not uncommon for several siblings or parents to have the same FSGS diagnosis. But there are other causes that we're still struggling to understand.
Well, how are you presently treating FSGS?
Well, we are treating FSGS with a lot of standard medications that are used to manage blood pressure, right? So there are class of medications, angiotensin converting enzyme inhibitors or angiotensin receptor blockers, ACE or ARBs, as we call them, which are really first line, right? Because one of the main symptoms that patients have when they have FSGS is that they tend to retain fluid because they're spilling a lot of protein in the urine. We see things like the cholesterol going up. So these we have to manage with water pills and blood pressure medication. And then beyond that, we really try to get to a primary treatment, as we call it, with steroids, right? It's sort of a first line agent specific for the disorder. But of course, steroids have a number of different targets. They have a lot of different side effects. And patients don't tend to respond that well by going to a remission clinically with steroids. So we are, looking for other options beyond standard management. There are various other immunosuppressive medications that are typically used to manage transplant patients that we tend to repurpose to use for FSGS as well. And they also have a variable efficacy and success in managing this disorder.
Understood. Now, we do have a question that is coming from the audience, so our producer will send that over to us. Okay. What are the most common causes, again, of kidney disease?
Yeah. So the number one cause is diabetes, right? And the second most common is hypertension. So diabetes, hypertension, really, again, accounting for up to 75-80% of the underlying causes. There are other genetic disorders, polycystic kidney disease, and then some of the rarer ones that we're talking about today, like FSGS, and of course, you tend to go down the list, and other systemic disorders. Lupus can affect the kidneys significantly. Patients with a high burden of kidney stone disease can also have a decrease in kidney function. So there are a variety of etiologies out there.
Understood. So now, again, what percentage, could you just say again, of African Americans could possibly have FSGS?
Yeah, so no, it actually is, again, it's a rare disorder, so probably less than about 200,000 total in the US. And the exact number is a little bit unclear because they're primary versus secondary forms, so it does get a little bit unclear. But what we do know is that Black patients are almost 4 times as likely to have FSGS than white patients. So right. It is absolutely more prevalent in the African American community.
So this is something that we really should look out for. And then in terms of the symptoms, could you speak to that?
Right.
No, again, I know you're saying you need to have a doctor do a biopsy, but what would make you run to the doctor if you had
Exactly. So there are some pretty clear symptoms that can happen when FSGS is in its most severe form, which is what we call a nephrotic syndrome, right? Those patients tend to have a lot of swelling. They're retaining fluid, right? But there are several disorders that can cause patients to hold on to fluids, right? Heart disease, liver disease can cause it as well. So if it's due to spilling a lot of protein in the urine, then the primary care physician would absolutely refer the patient to a nephrologist. So I think looking out for any sign of fluid retention, holding on, swelling in the legs, around the eyelids, those are symptoms that will be consistent with spilling protein in the urine. But again, other causes have to be ruled out. And then there are patients who, on just a routine physical or an employment assessment, somebody will do a urine study and notice just spilling protein in the urine. So the telltale sign of FSGS is really spilling protein in the urine. But of course, it may not cause a clinical symptom like fluid retention unless it's a lot of protein being spilled. So this is why it's important to get regular checkups, just the routine screenings, measuring the kidney function with blood work, and also protein in the urine with the urine studies.
When we were doing some of our campaigns to help educate our community about FSGS, we also talked about foamy urine.
Right. Yes, that actually is interesting because, for the last several centuries, foam in the urine was one of the classic signs that there was a problem with the kidneys. But of course, there are a lot of patients who may have foamy urine from other causes, depending on what's being excreted in the urine. It's not necessarily protein, but there absolutely can be a correlation. And typically, when patients are spilling a lot of protein in the urine, we do ask about foam, and patients do mention it, but it's certainly not diagnostic.
Understood. Now, why is it important that patients with FSGS talk to their nephrologist about clinical trials?
That's a great question. As I mentioned before, we are sort of using drugs that are indicated for other diseases, right? There's actually no treatment that's approved by the Food and Drug Administration specifically for FSGS, right? So we're borrowing medications from other clinical indications, right? And the problem with that approach, and no doubt there are some patients who respond well, but the side effect profile is usually not what we intend or what we want to see. So I mentioned steroids before. For FSGS, probably only 20-30% of patients actually get a significant remission, right, in terms of successful treatment when we give them steroids. And they often complain that, they just feel lousy when they take steroids. They don't sleep well. There's anxiety. People break out and get skin changes. A lot of patients get significant weight gain, right? So what we really want, and the goal of clinical trials, is to develop targeted treatment, right, to understand the disease process better, and to give a specific treatment option that's more tolerable, a better side effect profile that'll likely work better than what we're using that's currently available. So trials are very, very important for disorders like this and other rare disease.
Can you tell us in terms of when people, are they receptive to participation in clinical trials? We know that African Americans need to learn more about it so that they can evaluate to see if it's really for them.
Right.
Do you find that there's hesitancy? What do you tell your patients so that they may be more interested in participating?
It's also a great point because across clinical specialties, I talk to my colleagues in oncology and cardiology, and we absolutely do see an underrepresentation of African American patients enrolling in trials, and that's very unfortunate, right? I think there are a number of barriers. I think that from the patient perspective, there is a hesitation to trying a medication that's not approved, right? Because it is certainly a study, right? So there is that phenomenon where some patients may feel that they're being experimented on, or they may feel like a guinea pig. There is the reality that in clinical trials, there is a placebo group quite often where patients may have a 50-50 chance of getting the study drug versus a placebo control. And of course, on the physician side, not all physicians are participating in clinical trials where they're comfortable offering that as an option to patients, right? In my specialty, we found that perhaps less than 10% of nephrologists are actually actively engaged in trials. And it's a similar, number across certain other specialties. So there are physician barriers, there are patient barriers, and trials also, are not available at every site in every geographic location. So, we do need to look at the clinical trials infrastructure and how we better support that at a national level too.
Do patients often think that they won't have optimum care if they participate in a clinical trial? That could be a myth that's being perpetuated.
Yeah, I think it is a myth, and what I tell my patients is you get actually the closest follow-up you could imagine, right? Because in addition to clinically indicated, regularly scheduled visits, you have additional study visits where very extensive labs are done above and beyond what you'd normally do in the normal clinical setting. You often have a direct conduit to your physician. I often say, those are the patients that have my cell phone number, right? The ones that are in the clinical trials, right? Because I need to know every single thing that's happening with them, right? Any change in a new symptom, whether related or not, we need to know about it, right? As the investigating team and site. Every patient has a dedicated coordinator that they can contact. I mean, there's a 24/7 number, right? They can call with any concern. So I think that the level of care and scrutiny for any patient enrolling in a clinical trial is much higher than they would believe. But you're right, that can be a concern that we have to address when we're offering the trial as an option.
Okay. Now, how do you counsel caregivers? I mean, is there a role that they play in helping the patient who has FSGS?
Yes, because this FSGS is certainly a disorder that can progress towards end-stage disease. It's actually the most common primary glomerular disease, as we call it, and certainly, as I mentioned, most prevalent in African Americans. So there are a lot of associated symptoms, and caregivers, can play a significant role in being very supportive. Patients do need to have dietary modifications, right? So, we do know that family support and social support in adhering to a proper diet with low salt intake, for example, can be quite important in managing these disorders. Ensuring that patients are able to take the medications as prescribed, as indicated. There's some patients who need help in child care and transportation to get to study visits and clinical visits. So having that social support network is important. We also love to see when patients come in, with a family member or a friend to the visit, because it can be overwhelming, right? To sit there and get all the information in a dedicated visit. So having someone around who can reinforce the instructions and sort of ask questions on your behalf can be immensely helpful. Absolutely.
What other lifestyle modifications would you recommend if you have FSGS?
Yeah, so the recommendations that we have aren't necessarily that different from the traditional healthy lifestyle recommendations, right? So I mentioned a low salt diet, and we know that some of the medications that we use to treat FSGS actually work better when patients have a low salt intake. It's sort of a win-win. So salt intake is something that should be watched. Exercise helps. I mean, and we know this across kidney disease indications, even patients on dialysis, right? There's certainly been some evidence that they have better outcomes, right, if they exercise. Anything in general that's good for the heart could be good for the kidneys, right? So these two organs are uniquely intertwined. There's a whole specialty called cardiorenal disease that's booming at this point. So whatever is heart healthy is also kidney healthy as a general rule of thumb.
That's great to know. And I think, also with our new channel devoted to FSGS and kidney disease, we also talk about lifestyle, nutrition, we've got great recipes. So I'm glad that we're taking kind of the holistic approach to looking at the patient who has FSGS?
That's absolutely important, yes.
So what we want to do is we want to share the URL for our channel so everyone can see it and they can reference and go back to our website to see it. So what gets you excited about treating patients now, during this time when there's so many possibilities in terms of options for patients?
Yeah, so when I was in medical school and in training in nephrology, we really didn't have a lot of treatment options for patients with FSGS and related disorders. And I think really in the last 5 years or so, we've seen a dramatic increase in the number of clinical trials. There's tremendous excitement. We're actively engaged as a site for some very promising studies that we have patients in. So we are quite optimistic that in the next year or two, we will have FDA-approved treatment options for patients that are targeted, right, for FSGS and related disorders. So this would be a great development for our patients, and we're really quite optimistic.
So beside BlackHealthMatters.com, what other resource organizations could a person with FSGS turn to?
So there are a number of different organizations that are quite active in this space, and one that comes to mind is the NephCure Foundation, and they're sort of dedicated to FSGS and related disorders like IgA nephropathy, membranous nephropathy, minimal change, and advancing the quest for a cure for these disorders, right? The National Kidney Foundation, the American Society of Nephrology, they're also quite active in providing resources for patients and providers alike.
Excellent. Well, we are excited about having you present at our upcoming Black Health Matters Summit, which will be virtual. So it'll be the most significant health summit ever done for a virtual audience that is directed towards African Americans. And so we're delighted that you will present. We are, again, going to offer it. It's going to be all day. And we have you on, I believe, at 10 o'clock, between 10 and 11 o'clock, we have you on.
Looking forward to it.
So so all of your fans will be able to see you with our Black Health Matters virtual summit. So do we have any more questions that we would like to take from our audience this afternoon? We're turning it over to our producers. So we just have, there's no other questions at this time. So again, we thank you, Dr. Campbell, for your time and for your advocacy and work in advancing science on behalf of patients with kidney disease and FSGS. And we look forward to seeing you on July 18th.
Thank you so much. Thanks again.
All right. Thanks, everyone, for joining us, and we'll catch you soon.